Joining me on the news today. Now, there is some good news, and as always, it seems to come from Kerala, because while the number of active cases increase in Kerala, case fatality ratios low, and the vaccination drive there is successful, including the lowest vaccine wastage. What is it once again about the Kerala model that works? Take a look. Gopi Unithan reports.
Long queues, delays and bottlenecks. Months into India's historic vaccination mission, the country is nowhere close to meeting its targets. With state after state reporting shortages running parallel to huge wastages of vaccines. But one state is shining in the crisis. As vaccine shortages derail plans nearly everywhere else, Pinarayi Vijayan's Kerala is standing out for its super efficient use of vaccines. On Tuesday, the Kerala Chief Minister, fresh from a historic election victory that is said to have been possible because of his COVID governance, said that the state has not only ensured zero wastage, but has administered more vaccines than what has been provided. As on Monday, Kerala has received 73,38,860 doses of vaccine. However, the state has successfully administered 74,26,164 people with vaccines. This even as 3,15,580 are still remaining in the state stock. If you're confused about how there could be greater shots administered than vaccine doses received by Kerala, here's the explanation. Vaccines are stored in small glass bottles called vials. Each vial usually contains 10 doses of vaccine. However, manufacturers do include one extra dose, which is usually regarded as a wastage dose. While filling the syringe each time for each patient, it is possible that a small quantity may be wasted. The wastage dose is included to compensate for this loss. According to the Kerala government, the health staff has successfully administered up to 11 doses from most of its vials. This has helped the state vaccinate more people than the actual number of doses provided to the state.
അതീവ ശ്രദ്ധയോടെ വാക്സിൻ വിതരണം ചെയ്യാൻ സാധിച്ചത് ആരോഗ്യ പ്രവർത്തകരുടെ പ്രത്യേകിച്ച് നഴ്സുമാരുടെ മിടുക്കുകൊണ്ടാണ്. ആരോഗ്യ പ്രവർത്തകരെ ഇക്കാര്യത്തിൽ ഹാർദമായി അഭിനന്ദിക്കുന്നു.
The Chief Minister has also lauded his health workers with praise for their effort in leveraging the maximum from vaccine vials at a time when shortage looms large. But there's no time to celebrate the feat. Kerala's health minister says the situation remains alarming. Though the government has placed orders with manufacturers for vaccines, the supply is expected only by the end of this month.
Yeah, the situation is not very good, but we are enthusiastic that we can tackle this problem. Because of our preparedness, we are ready to vaccinate the people. Whenever we got the vaccine from either central government or from the companies, we just start the vaccination speedily.
Kerala was the state, remember, that recorded India's first COVID case in January last year. But it has come a long way. And now armed with a model that squeezes every drop out of limited vaccine consignments, the state is showing the way.
Vaccine shortage and vaccine wastage continues to be two important challenges for the country's fight against this pandemic. Indeed, the stories from Kerala is something that can be replicated across the country to ensure maximum utilization of the vaccine and ensure maximum people are protected from this deadly disease. With camera representing Rajshekharan, Gopikrishnan, Thiruvananthapuram for India Today.
And joining me now is a special guest. I'm joined by Dr. Asheel Muhammed, the public health specialist and executive director, Kerala Social Security Mission, and one of the driving forces behind Kerala's COVID-19 task force challenge. Appreciate your joining us, Dr. Muhammed. First of all, number of cases rising in Kerala between 30 and 40,000 consistently over the last week. But your case fatality ratio remains low, and we don't hear any complaints of bed shortage or even oxygen shortage from Kerala. So what is the secret of the Kerala model that other states can emulate?
Like, I don't think there is any shortcuts or secrets in that. The thing is that we have actually planned our surge capacity increase or surge capacity improvement. So the surge plans are actually we are expecting that around we will be having around 6 lakh active cases by May 15th. So now our current active cases is 4.2 lakhs. Everything depends upon, entire system depends upon the active cases per day or active cases in any given time. So if we see we have increased our surge capacity to cater to these numbers. Of course, we have some administrative predicament at some tightness, some crisis at some moment, but we are able to manage it. For that, we have actually maintained a kind of a district level control cell where every hospitals and every facilities are monitored for their availability of beds, availability of oxygen, availability of ventilators, availability of ICU beds, so that we don't face a crisis and everyone gets the appropriate treatment to the extent possible.
And Dr. Mohammed, when did you prepare for this surge? It almost seems as if Kerala, in that sense, was ahead of the rest of the nation. You were ready to prepare for the second wave, which many other parts of the country weren't. So when did you recognize that there was going to be a second wave?
We must look at the experience of global countries. Like many other countries have gone for the second wave much before any of us. So we know that it's a second wave is going to come. It's not that the wave should or epidemic should act in a separate way in India. So that's quite expected. And if you look at the history of any pandemics in the history, for example, Spanish flu, it came in 4 waves. So here also we are actually seeing many countries in COVID-19 also, we are seeing many countries going for third and fourth wave. So we must expect that there would be a kind of second wave, but we are not really, to be honest, we have not really expected it to be as high as this. But what we have done is that we have increased doubled our ventilators, doubled our ICU capacity, almost increased the daily oxygen production by around, our oxygen production per day was 50 milliliter, 50 metric ton per liter, 50 liter per minute per day, per 50 liter per minute. And we have increased to 1,250 liter per minute oxygen production. So similarly, if you see our daily requirement before the oxygen requirement for before our this wave was around 73 metric ton per day, we have increased it, our capacity to around 219 metric ton per day. So it is quite expected that we would be having a kind of second wave, and we need to prepare for that. We have prepared, but I must confess that it's not the wave is not as like we expected. It is quite higher than that, but still we are able to managing because
is that because there was? Is that because, Dr. Mohammed, there was some negligence in Kerala like we saw in other parts of the country during the elections? In your elections of March, April, people went out, campaigned, there were fewer masks worn, no social distancing. To that extent, March, April was the one period where even Kerala let its guard down.
Yeah, I must say that as a health professional, we are literally disappointed in that, because if you see, we have been able to delay the peak of the first wave, even after being the first state to report the cases. We are the last state to peak. But and when the cases decreased in January, February, the people get into complacency, and obviously the pandemic fatigue would set in, and there would be rebound socialization. And at the same moment, the elections came. So that actually there were a lot of interactions where there were no social distancing. There was a lot of unprotected interactions. So what would have happened in that is that what we expected the impact of elections is that we have actually pulled our second wave to much nearer, because if you see the experience of many states and many countries, the gap between the first wave and the second wave is around 2 months to 3 months. But we really did not get that gap, because we just stepped down and just came right into the second wave. So elections would have definitely brought our second wave to a much earlier period, but second wave is inevitable for sure.
But you seem to have learned the lessons in keeping, as you said, your medical infrastructure in place, your oxygen supplies are in place, even though I'm told now the Chief Minister has asked for more oxygen from the center. And in terms of vaccination wastage, you've got your act together. So it appears that by and large, you seem better prepared than others. Is that, as is being suggested by many, because of the state of your public health infrastructure? Kerala has invested traditionally much more than other states, and you are reaping the benefits to some extent. So even when active cases are higher, your case fatality ratio is well below the national average.
Yeah, when we see the active cases, that has something to do with the detection rate also. If you see in the earlier wave, in the first wave, when you see and when we have paired it with or compare it with the zero prevalence study, if you see our cases were around 10 lakhs in the first wave. So, but if you look at the zero prevalence study, it was found that every third case in the state is reported or detected, whereas that of a national average is around every 1 out of 21 cases. And in many parts of the country, it is around 1 out of 60 cases in the population. If you look at the zero prevalence study compared with the detection. So, so when you look at the active cases or numbers of the cases are almost deceiving many times, because numbers also reflect on how much you detect or how much you actually confirm through a system. So that also had to do with the testing strategy, that has also to do with the containment measures in place. So we are really not bothered about the actual number of cases, because if you need to get into a kind of herd immunity, it's a path where many people gets infected. So we don't rely on infections for herd immunity. We rely on vaccines for herd immunity. But as we know that 89% of the people are still susceptible when we enter the second wave, as only 11% was infected in the first wave. So we expect that there will be a number of cases would be very high. And our main priority is to prevent deaths, because if you see around 98% across the globe, 98% of the people who get infected recovers. So our aim is to actually bring down that to the deaths to the very minimum to the extent possible. Because if you look at the vulnerability of deaths in Kerala, if you see on a demographic and epidemiological basis, we have a population where elderly population is around 14%, whereas that of national average is around 9%. We have a diabetes of around every fifth, 1 out of 5 person in Kerala is diabetic, due to many other reasons, adult population. So we have a vulnerable population. So it's our duty to guard them. And as you said, we have been traditionally and investing in the public health. But I don't think we must be boasting about that. And only thing is that all the sentence I say when about our infrastructures, and nothing is invincible, because every system, even Ambani's house cannot cater to 50,000 people per day. So there is a limit for everything, and the surge capacity threshold is something which decides our response. So what we did is to increase our surge capacity threshold to cater to the maximum people.
Well, that is the secret, in a way, of the Kerala success. And I keep repeating, what Kerala thinks today, India must think tomorrow. Think about it. When we return,